All right, looks like we're at a minute past, so we will go ahead and get started here. Welcome everyone to Advancing Health Center Recruitment and Retention through Health Professions Education and Training. Today we have with us from Salud Family Health, Dr. Ethan Kerns, who's the head of their dental department, and he will be sharing about their staff development program with us today. Real quick as we get started here, I know everyone has probably had so much Zoom experience, they're now a qualified expert, but just in case you have any technical issues, please send us a chat or you can email Mariah Blake at mblake@clinicians.org. Then we'll be recording today's session and sending that out along with a PDF of the presentation at the end of the session today. And then at the very end, we're going to put a little evaluation up. If you'd please fill that out for us, it's really helpful on our end. And we're here on behalf of the Association of Clinicians for the Underserved. ACU was started about 25 years ago by alumni of the National Health Service Corps, and ever since then has worked really hard to make sure that our mission of improving the health of America's underserved populations by supporting the clinicians serving in those areas is carried out. And so we support health centers and other health-focused institutions all over the U.S. with recruitment and retention and just managing their workforce. ACU also has several programs, including a vision services program where we help health centers set up vision services, and then also a suicide safer care training program for clinicians and patients. And then we're here today on behalf of the STAR Center, which is ACU's NTAP, our National Training and Technical Assistance Partner. And the STAR Center is our Solutions Training and Assistance for Recruitment and Retention Center. So we focus specifically on recruitment and retention issues and helping health centers and PCAs tackle those. So we've got several people from the STAR Center team here today. And please feel free to reach out to any of us if you have questions or need help with anything. We're always available to assist. Now, real quick, we're just going to do a little Mentimeter icebreaker. So if you have a smartphone, you can pull it out and just scan the QR code. Otherwise, let me put that into the chat. You can go to menti.com. and type in the code 71353574 there, and that is there we go, that's in the chat. So you go to there, and I don't know, I was just thinking about this the other day, everyone has like their own personally unique food combination. And so I just wondered what people's interesting combinations were. So someone has strawberries and basil, cottage cheese, molasses. I don't know if you're combining molasses with anything or just eating it, spooning it right out of the thing. That's okay too. Whatever interesting thing. Mine's like, in a way, very normal, peanut butter and jelly. But I like stir them together, like mix them together really well. And it's a very different consistency, so it's kind of weird. All right, maybe that all woke us up this afternoon, kind of the post-lunch, depending on your time zone. But all right, oh, Wendy's Nuggets and Frosties, that's a classic, that's a classic. All right, well, I appreciate everyone joining in on that. And now I will go back and introduce Dr. Ethan Kerns, who again is the Chief Dental Officer for Salud Family Health in Colorado. And he oversees 10 dental clinics across northeastern Colorado. And in this role, he's responsible for the leadership of the state's largest federally qualified health center dental department. He also oversees the credentialing and privileging access for Salud's 400 clinical staff members, supervises all the care management and services for Salud Family Health. So he's kind of busy. So I guess in his spare time, He is the chair of the Government Relations Council for the Colorado Dental Association, a past co-chair of the NNOHA Practice Management Committee, and is the current president for the NOAA board. And he's proud to continue providing comprehensive dental care to the underserved populations in his community. So this gentleman is quite busy doing some amazing things. So I'm really excited to have him here with us today. And with that, I will turn over the presentation to Dr. Kerns.
All right, thank you, Alex. Let me bring up my PowerPoint. Can you see it okay? Perfect. All right, well, thank you for the introduction. Hello, everybody. As was mentioned, I'm Dr. Ethan Kerns, and I'm at a federally qualified community health center in Northeast Colorado, and we have multiple centers. And like everybody, I think we have faced some workforce challenges over the last few years. And one of our solutions, and we actually started working on this before the pandemic, but we decided to put together some career ladders for our support staff to help train them to be successful in their roles. And so we call this our career ladders. And again, it is our process for training and advancing our internal workforce. So we'll go ahead and we'll get started here. So our career ladders is our development program for our support team members. So we have 8 ladders, and I want to stress that it's not for everybody. This is just for our support team, and I'll show you who those members are throughout the presentation. Our ladders are our comprehensive curriculum to help develop job-related knowledge and skills. Before we went down this path and put the ladders together, we found that there were varying degrees of knowledge and skills between, different medical assistants, between different dental assistants. And what we wanted to do was get them all up to the level where they're practicing at the top of what they're allowed to do, and they feel confident in doing that. This was definitely a commitment to invest in our team members. Putting these career ladders together took us years. It took us a lot longer than we thought. And it takes time and some money to put this together. And then lastly, our career ladders develop confident and qualified frontline staff. And that really benefits the frontline staff. It benefits our providers and everybody else at Salud. And most importantly, it benefits our patients that we serve. So our career ladders are a piece of our education department, but our education department is bigger. The career ladders, once again, is just for our frontline staff, but our education department would include everybody at Salud, including, for example, providers. So there would be other trainings besides career ladders, things like OSHA training or HIPAA training that would fall under education. So I just want to clarify this. We have more training than just career ladders, but it is a big component of the training we provide here at Salud. So why are these career ladders important? We wanted our staff to have the support, the resources, and the training to succeed. We found that when we were hiring new staff, onboarding them, it often was not consistent between our 10 clinics. Often some were receiving more training than others, and some just felt more confident in their work. So we felt if we could standardize that, and again, set it at a level where they are practicing at the top of what is allowed, then that would benefit everybody. Research shows that people who would have advanced job knowledge and skills enjoy being at work more. They provide superior service to our customers, which to us would be our patients, but also the other people who work at our organization. And they themselves are more satisfied with the experience. And that's what these career ladders do. They were meant for new team members, but also for experienced team members. So as I mentioned, between our clinics, we had varying degrees of expertise among medical assistants, among pharmacy techs, among our customer service associates. So we wanted to get our current staff up to the same level, the same confidence, but this also allowed us to have a really strong training program for new employees. Prior to this, and I've heard many other organizations are similar way, and I'll just speak from the dental side since I'm a dentist. Many health centers will require dental assistants to have a certificate. They went through an education program before they're eligible to apply to be a dental assistant at that health center. And for us, we thought, well, if we can train them ourselves then that allows me to have more applicants in the pool and allows me to go find the person that I think is the right fit for our organization. And then I can train them to be a successful dental assistant. And some states may differ on this based on the rules passed by the board. Here in Colorado, our dental assistants do not need to be certified. They do not need to get a certificate. And so we can go out, again, choose the best person that I think is going to fit into our system, the best fit for us, and then we will train them to be a successful dental assistant. So designed for new staff, but also for current staff. The courses are meant to appeal to a variety of learning styles, and we'll get into this a little more depth further into the presentation. But we learned quickly that people learn differently. Some people are fine to learn just by doing computer courses and reading on a computer. Other people want to have something printed in front of them. So as an example, when we prepared materials for our dental assistants to pass the certification exam, we had an online course that reviewed all the contents of the ladders so they could study on the computer for it. We also printed a pretty large manual of our courses, and we organized it so that if they wanted to take it home and study it, something to flip through paper, they could. And then we also made color-coded flashcards, color coding by level on our ladders, which is going to make more sense when you see it, because some people wanted flashcards. So that just demonstrates we try to get the same content in different formats because some people learn differently. So we did try to incorporate that into our process. And again, this content prepares staff to improve their job skills and knowledge, as well as to pass any of their certification exams and competencies. And of our 8 ladders, only 3 have to pass a certification exam, and we'll show that. But that would be our medical assistants, our dental assistants, and our pharmacy techs. So how do staff complete the courses for our ladders? How do they start? All of our courses are done online, and we use a learning management system, often called an LMS. And we went through a few variations of this. We started with using a program called Canvas, and then we later switched to a program called Bridge. And then now we use something called UKG Pro. And that's just because it's the software we use for our timesheets and accounting. And they had a learning management system. So we switched to theirs, so it was combined. Our courses are typically 30 to 40 minutes a piece, but they can vary by topic and discipline. So when I start showing the ladders here in a few slides, so you know how it's structured, you'll see some of the ladders may have 10 courses per level, and other ladders might have 18. But some of the courses might vary in length. It depends how much content is in the course. As a rule of thumb, we found that keeping them short or shorter made it easier for the staff to complete it, because we asked them to complete these courses during business hours, and it was easier to find a window to free up, a call center agent for 30 minutes than it was, say, for an hour and a half. So we did shoot for shorter courses if we could. And then after completing each course, the staff must pass an exam showing that they understood and took away the content we wanted. If they don't pass the exam, they must retake the course, and then the quiz has different questions. So each ladder was designed by a lead to oversee the construction and timeline of development. Again, we have 8 ladders, and we're getting close here to showing what they are. And then each ladder was put in charge of by a lead. And so I was the lead for dental. I have 2 ladders, one for dental assistants and one for dental clinic coordinators, which are essentially dental front desk staff. So it was up to me to determine what content do I want my ladder, what skills do I need my dental assistants, my dental front desk to have? What level do I want them trained up to? And so I determine these things, but then I'd also bring in some help, some subject matter experts that actually help to build the content. So the leads were the directors of those areas. And then we would create the content, and we determine which levels to assign the courses to. So if we make a course, does it go in the first level, the second level, the third level? So you need to have leads that will champion this and build these. So here are our 8 ladders. We have one for our call center agents. We have one for our customer service associates, which are like the receptionist when you walk in the front door. They check in patients, answer phone calls, things like that. We have dental assistants. We have dental clinic coordinators, which again is dental front desk staff. We have a ladder for enrollment specialists, a ladder for medical records, one for pharmacy technicians, and then one for medical support staff, like medical assistants. So these are our 8 ladders that we have created. So I know there's a lot of writing on this and it's small. I don't expect you all to read this, but this is the structure of what our ladders look like. All 8 look similar. So we all have, starting at the left, the orientation level that must be completed within the first 90 days of any new staff. Then we go on to the apprentice level, and that has to be completed by the end of the first year. And it's a progression. The staff must pass the orientation level before they can move on to the apprentice level. And then you go on to level 1, and that must be completed by the end of their first year. And those first 3 levels are required. You'll see in the red horizontal bar. We require all staff to complete level 1. And then the level 2, 3, and 4 on the right side, you'll see that those are optional. And we'll get into those. Those are exactly the same across all 8 ladders. All the courses are. Those are things like soft skills, management training, supervision. It's preparing our staff to move to a leadership role. If you have a medical assistant, dental assistant, they want to become a lead dental assistant or a lead MA, then these are the courses that will give them those skills on how to be a successful supervisor or manager. So this helps to promote within as well. So I will go through some of the courses here. I'm not going to read every course, but I do want to give you a flavor for what we created for our ladders. And you'll notice as we go across the 8, that some of the courses are used on multiple ladders. There's overlap. So we'll start with the orientation here for a call center agent. So you've got before the call, you have making the connection, creating a climate for rapport, effective listening, questioning skills, holding and transferring calls. And these are all things that are helpful to somebody whose role it is to work in a call center. Positive call management, patient registration, phone etiquette, introduction to ECW, that is our electronic health record, eClinicalWorks. Common acronyms, our no-show policy, and suicide patient protocol. So those are the ones we determined somebody must pass within their first 90 days. They need to know those topics right away. And also these can sometimes be building blocks before you move on to apprentice. You have to know these things before you can learn the apprentice level courses. So in the apprentice level, there's courses like telephone encounters, proper documentation, one call resolution, de-escalating calls, rewards of telephone courtesy, HIPAA. There's a whole bunch of courses on HIPAA because it's a really large topic, like disclosure to family and friends, security, HIPAA the basics. And then moving on to level 1, which is the last required level, then you get into things like medical terminology, dental terminology, medication refills, customer service confrontation and conflict, service matters, handling conflict, managing stress at work, in doubt, find out, listen for understanding, disagree constructively, champion diversity, proper documentation, neutralize bullying. So you can get a sense that this level 1, this is somebody who knows the basics of the role, and now they're getting training on how to manage difficult conversations, difficult situations. We're building on their experience and the courses that they have already passed. So then we'll go to our next ladder. This is customer service associates. And you might see some overlap here in some of the courses between our call center agents and our customer service associates, which again are the receptionists at the front desk, because some of their role overlap. So you've got introduction to the role, you have learning about the electronic health record, workspace management, an introduction to how to use Outlook, quick registration, HIPAA review, email etiquette, phone etiquette, check-in and check-out, collecting and handling money, billing questions, patient feedback, day-ahead prep, releases of information. These are just examples of courses that we have in the orientation. You can see we've got 19 courses there. Many of those are going to be quicker. They're going to be the 30-minute courses. whereas some of the ladders that have fewer courses might have them be longer. For the apprentice level, building on top of what they learned in orientation, they'll take courses on Medicaid, Medicare, and CHIP Plus, Medicare Beyond the Basics, literacy, medical records training, billing training, and using Excel and Word. And then level 1, you'll see some overlap with the customer service or with the call center agents. You've got medical terminology, dental terminology, handling conflict, managing stress, disagreeing constructively. Again, how do you handle, upset patients or difficult situations? Moving on to dental assistant curriculum. So this is one of the ladders that I was the lead for. Here you've got your dental record, which depending on your organization might be different than your medical record. You've got introduction to dental radiology, dental chairside procedure part 1. So you'll notice in higher levels, there'll be a part 2, right? The content builds on itself. You have dental instruments and equipment part 1, medication management, dental office procedures, and dental assistant clinical training. So I do want to focus on this dental assistant clinical training for a moment at the bottom of orientation, because I've been asked, well, the ladders, it's all done on the computer, but how do you incorporate clinical skills that need to be demonstrated in the clinic? And so for me, I also have a 3-page competency that dental assistants must pass at the end of the 90 days, same time frame as the orientation ladder. And that'll cover things like, can the assistant demonstrate that they can set up a dental operatory correctly, that they can turn a room properly, that they can take x-rays that are diagnostic, that they can do sterilization of instruments properly, that they can document in the electronic record properly. Those are things that have to be demonstrated in the clinic. So the way we tie it back to the ladder is that level 7 course into orientation, dental assistant clinical training, that cannot be finished until the clinical competency has been signed by the supervisor in the clinic. So once they demonstrate all those things in the clinic, then we can check off and finish this dental assistant clinical training on the ladder. So that's how we connect the pieces and that we don't let it fall through the cracks. Because some of these roles, they do have a clinical component that must be demonstrated. Moving on to the apprentice, you're going to start to see some level 2 courses like dental chairside procedure 2, dental instruments and equipment part 2. Obviously, it is building on top of what we learned in the orientation level. And then you get things like basic dental terminology. When I asked my staff, what do you want to learn about? It was pretty unanimous that they wanted to learn more about dental terminology. I received feedback that our students and our residents at our 10 sites were using terms that the dental assistants didn't always understand. So they wanted terminology so that they could understand more of what the students and residents were saying. Again, this was an investment in our staff. And I'll go into a little bit how I determined what should go in my ladders. How did I determine what content I wanted them to learn? We'll talk about that. But I also asked them what they wanted because we tried to inform our staff, we're investing in them. This is for their benefit. What do they want? So that's an example of feedback that we took and made the course. And then just for the level 1, which is the 3rd level, you've got things like nitrous, advanced dental terminology, and then you start getting into quality metrics like the hypertension quality metric. You have dental ethics and professional conduct. And then the last course is AMT exam preparation. And we'll talk about that later. That is the certification exam for dental assistants that they are required to pass. And so we finished with a preparation exam for them. The dental clinic coordinator ladder, this is our 4th one. This is going to be an overlap of what you saw on the dental assistant ladder and what you saw on the customer service associate receptionist ladder. Because really, this is a combined role. And I expect my dental front desk to be able to help in the back when needed. They can go help set up a room, they can go help in sterilization, or they can turn a room or seat a patient. So you'll see many of these courses were pulled off of those 2 ladders and combined into one. And it's useful to reuse these courses that are important across multiple ladders. So we have our 5th one here, which is the enrollment specialist. And you can see on the orientation, it starts with the very basic. What is the role of an enrollment specialist? what are the job skills they need, and there is a competency test. Again, that is something done in the clinic that must be signed off before this course can be completed. You have enrollment newsletters, and you have in-person enrollment specialist training. And also with orientation, we have some courses like the history of Salud. What is an FQHC? What is the history of FQHCs? You know, so there's also courses in there that aren't listed here that just introduce them to who we are as an organization, not just their role. So when you get to the apprentice level for enrollment specialist, you have things like navigating the health coverage ecosystem, Colorado Medicaid benefits, the Accountable Care Collaborative, private health insurance plans, and private health insurance literacy. And then level 1, you have things, you know, that you've seen before, and then the other ladders: Medicare basics, medical terminology, handling conflict, managing stress at work, things like that. All right, our 6th ladder is medical records. And here you've got things, again, introducing them to their role. What do they do in medical records? You have managing incoming records, managing outgoing records, how to scan, creating diagnostic imaging and lab orders. For the apprentice level, you have courses like diagnostic imaging reports, understanding lab reports. And then for level 1, again, you'll see many of the same courses we have across other ladders. You've got the medical terminology, you have act ethically, things like that. So now we get into medical. So here's your medical support staff. So your MA has a lot of training. This is one of the most robust ladders we have, as you can tell just by the content of what must be learned. So on the orientation, there's a lot they have to learn within the first 90 days. And again, there's going to be a piece that is demonstrated clinically on site, but then it's pulled back where it needs to be crossed off before we can move up the ladder levels. So you've got lab basics for the orientation level. You have medical room disinfection, surface disinfection, hand hygiene, environment of care, lab skills, job shadowing. So again, there's one from the clinic that has to be checked off. Rooming a patient, vital sign basics, the exam room, phlebotomy basics, medication administration, suicidal patient protocol, quite a few courses on vaccines, such as storage and handling. For the apprentice, some of the courses here, you have things like medical department standing orders, navigating the treatment window, telephone and web encounters, well child checks, administering urgent medications, women's programs at Salud, and then oxygen therapy and ambulatory care. And then by the time you get to level 1, there's quite a bit they have to be demonstrating in the clinic. So order of a blood draw, the Colorado quit line referral for tobacco. You've got INS forms, ankle brachial index, hunger-free Colorado, billing for therapeutic injections, and then another quality measure for weight screening. So again, just some examples of what need to be passed on the medical support staff curriculum. It's quite a bit. It's again, probably our most robust ladder. And then last is pharmacy tech. We have to have pharmacy techs also get certified. And you can see just from here, again, the structure is the same. Their orientation apprentice level 1 are different from the other ladders. You don't have as much overlap with this one. In the orientation, you have things like prescription processing, intro to pharmacy billing and reimbursement, inventory management, medication error, and patient safety. For the apprentice, you're going to see some level 2 courses that are building on the orientation. You've got prescription filling, pharmacology intro, pharmacy law, pharmacy math, part 1, and pharmacy calculations. And then level 1, the last required level, you have things like pharmacology, math 2, pharmacy tech certification, test prep, dosages, and medical orders. So I know we spent a lot of time on that, but I think it's important just to see the variety of courses that we use, but some of them can be used across ladders as well. So we created all of our content for the career ladders. How did we do this? First of all, we use textbooks. We talked to schools. I know on the dental side, I talked to dental assisting schools. What are you teaching? Why are you teaching it? We created many videos at our clinics as well. We were very aware of copyright. And so we did a lot of the work ourselves. So many videos, and I think the next slide might have an example of one, where it's in our own operatory with our own staff, with our own instruments and our own materials. So we did make quite a few videos, and that is time consuming to do it well. We purchased a lot of photos from third-party vendors, again, to avoid copyright issues. We do have a lawyer in our staff, so we were really conscious that we were following all copyright. We also had champions who reviewed our content and took our exams before rolling it out. So I had a number of really strong dental assistant leads where I recruited them. They were excited about the project, and I had them go through the ladders before we rolled it to the other 60 dental assistants, where they would take the courses, take the exams, make sure everything looked correct. And then we solicited feedback throughout the process. And I already gave you an example there where my dental staff said they wanted terminology that wasn't necessarily on their certification exam per se, but they wanted that course, so we put it together. And we did look at outside canned content. You can buy courses that are pre-made. There is obviously a cost to that, but we just felt like it didn't meet our needs here at Salud. That's why we preferred to make most of the videos ourselves. This just shows how it was developed. Again, I was the lead. I didn't put it all together. I had subject matter experts that helped. I had a dentist, a hygienist, and some dental assistants who helped draft review the content. And to determine what I put on my dental ladder, I think I mentioned that I do require all dental assistants here to be certified. So what we did is we looked at the certification exam requirements. What did they need to know to pass that test? So we use American Medical Technologists. That's the exam we use. For those of you in the dental world, you might be familiar with DANB. There's different certification exams that dental assistants can take. We chose, again, American Medical Technologists because our medical assistants were already using them for their certification exam. We already had an account with them. And so we took the outline of what dental assistants needed to know to pass that AMT exam, and we worked backwards. That's where we started developing our courses. What did they need to learn? And then obviously we filled in with Salud specific items as well. And to put in perspective, well, when you look at the ladder, how do you break out the type of content? And for the AMT exam, about 14% of their questions cover office assisting skills, 35% are on dental sciences, about 27% are on clinical procedures, and about 24% are on dental imaging. And I would say it's probably a similar percentage on our ladder about how you break up the content. We probably don't have 24% on imaging, but again, this was the framework we used. This was the end goal. I needed my first 3 levels of my ladder to prepare my dental assistants to pass this AMT exam. So let's go through what a course looks like. Every course will start with course objectives and outcomes. We want to clearly tell staff what they should be getting out of this when they start that course. And this is just a screenshot from one of my dental courses. I talked about videos. We use a lot of writing, but we also try to use graphics, pictures, and videos to mix it up a little bit. As I mentioned, staff learn differently. And if it's just a lot of text, sometimes people lose some of their focus and they just don't take as much away from it. So on this left side is a video where it just shows our dentist is telling assistants how to transfer instruments on the patient. And the right is just a screenshot of one of our medical videos and this is one that we did purchase. And that's just on how to do the ankle brachial index test. So just trying to use a few different types of content to teach our staff. At the end of every course, there is an exam. And how many questions there are will differ based on how much content there was. Everyone must get at least an 80% on the exam to pass the course. So let's say you didn't pass the course, then you would have to go retake the course again, and then you get a new exam and it'll have different questions. For every course, we made a large bank of questions that are randomly pulled. So you can't just retake the course and answer the same questions again. We really want them to take away the knowledge because they're going to need it to pass that certification exam. So must get 80% on the exam after each course. And once they complete the course, they get a certificate that is emailed to them. And that way everyone knows, okay, I am done with this course. It's clear. And for at least dental assistants, some of these courses can be counted as continuing education, so that they can be, they can count toward the annual CE requirement to maintain certification. So now let's talk about how do you move between levels. So let's say that you completed the orientation level courses. You finished them all, you passed all those exams. Then what you'll have to do is you must pass the end of ladder exam. So let's say your orientation has 15 courses and you passed each course with the exam. You must pass a final exam that asks questions from all 15 courses, and you must get an 80% on it to pass. Again, if you didn't pass it and you have to retake that exam, then you're not going to get the same questions once again. So they have to retain the knowledge after they take the course. So let's say you did pass that final exam. Then how do you move from orientation level to the apprentice level? So you've got to pass this final exam. Then you also have to have a current employee evaluation that meets or exceeds expectation. You cannot have a performance evaluation, where you have a performance improvement plan or not meeting expectations. And you cannot have any written employee counseling notices or write-ups from their supervisor within the last 6 months. We color-coded our ladders. So you might recognize these colors were the same ones I showed you on the screen with the 8 different ladders. And based on what ladder level you are is the different colored lanyard that you get. So as you move up, you get a new colored lanyard to match that level. And these colors are used throughout the process. I think I mentioned that we made flashcards for each level, so that when they're preparing for the end of orientation level exam or the end of the apprentice level exam, they can use flashcards. They're the same color as these lanyards. It's all color coded. We talked about the timeline. When we hire somebody, they need to complete the required levels by the end of their 2nd year. If they have not completed it by the end of their 2nd year with us, then their supervisor is notified and they have 30 days to finish. If they don't finish within 30 days, if they don't finish level 1 for their job, then they will be dismissed from their role. So let's say I had a dental assistant. It's their 2-year anniversary. We notify their supervisor, the dental director at the site, hey, the staff member needs to finish level 1. They have 30 days to do it. If they still don't complete it, then they're told they could no longer be a dental assistant with us, given 2-week notice, but they are eligible to apply for a different role in Salud, where maybe they can be more successful. So this is a requirement the staff must complete. This gives you just a snapshot of where we are currently with our ladders. We have 49 staff in orientation. So those are newer people. I think all of us have probably been hiring people during this pandemic. We have currently 52 in the apprentice level, 28 level 1. Those are the required. And then I haven't talked about it yet, but we'll get to the higher levels that are optional. We have 95 in level 2, 96 in level 3. We have 54 ready to start the last level, which is still under construction, but I'll talk about it. And that's our CAPSTONE project. So that gives you, an idea on volume about how many of our staff have gone through these ladders. I already covered the medical ladder with you, but I do want to point out that these evolve, right? We're never done. We still have visions for what we want to add to these ladders. So in medical's case, they would love to be able to add content on some of these ideas here. The option to enroll in expanded scope medical assistants, advanced training in OB care and immunization lead positions, training to be a shared medical appointment facilitator, opportunities to be a clinical quality lead. All of us I know are focusing on quality, learning more about medical dental integration, and learning more about medical behavioral health integration. So those are items that are on the agenda to build for us. And so we don't view these as ever complete. It'll continue to evolve based on what we feel our staff need to know. We covered the dental assistant ladder. I think we covered the AMT. This is a certification exam. In Colorado, my dental assistants are not required to be certified, but we decided we wanted them to be certified. That's the level that pharmacy techs must get to. That's the level medical assistants must get to. And we decided we wanted to hold our dental assistants to the same standard. And so I mentioned our content prepares them to take the AMT, and they must pass it. So if they don't pass the AMT exam, which again is not Salud, right? They have to go elsewhere to take this test because this is a national certification. If they fail the test, they have 60 days to retake the exam. If they take it 3 times and fail the 3rd time, then they are given their 2-week notice that they can no longer be a dental assistant, but they're welcome to find another position in Salud. So for us, they must complete level 1 and they must pass the AMT exam. At this point, I've had 1 dental assistant that didn't pass on the first try. Everyone else has passed. So I believe I've had about 60 dental assistants now become certified through this process. So we feel confident that the ladder we built is preparing them to pass the certification exam and to practice at the top of what they're allowed to do. Again, having 60 people become certified, I think is a great accomplishment. And we don't just have them get certified, we have them maintain it. So Salud will pay their fees to maintain it. We will help identify continuing education for them to take, because every 3 years they have to submit their CE and a fee to maintain that certification, and we have committed to doing that. Future goals, on the dental side, I'd love to incorporate some expanded function dental assistant training here in Colorado. They're not required to get a certificate to do these things, such as placing fillings, the steps of fabricating a denture. All of that can be done just on the job trained. So that's my next goal, is to incorporate how do we train our assistants to be expanded function and start making temporary crowns, placing fillings, things like that. So let's talk about the higher levels of the ladder. As I mentioned, these are the same across all 8 ladders. These are not discipline specific. These are ladders that help our staff who are interested in gaining more management skills. They may have aspirations of being a lead or a manager within the organization. So you can see in level 2 here, we talk about healthy communication, moving from peer to supervisor, stress and time management, employment law, leading a team, right? What we wanted to do is create a path for our staff to advance themselves if they're motivated to do so. It's really planning for the future, succession planning. And we have had a number of our staff move up within the organization. So we have found this to be helpful for them and for us, because many people want to grow in their role. For example, if somebody's a dental assistant, how do they grow? This is an opportunity for them to continue learning. For the level 3 is things like HR 101, performance management, what it takes to manage, coaching, and more employment law. And then level 4, this is still under construction, but we expect to roll it out within the next 2 months. We have all of our documents ready to go. And that is a CAPSTONE project, must be completed by that staff member. So we talked a little bit about this. Level 3 of 2, 3, and 4 are optional. They can take it if they want to, but they don't have to. So let's talk about the CAPSTONE project that we envision completing again within the next 2 months. What we wanted to do here is to have our staff start thinking about continuous quality improvement within our organization. We want them to not just see a problem, but to also think about the solution. And so that's why we came up with this CAPSTONE project. And this is really the end of the ladder, and this is trying to have them take everything they've learned and putting it all together. So what we want is that the employees will select a topic, problem, or process that they feel can be improved, and it should be related to Salud and/or our patients. Then they'll have to conduct research on the subject. They'll have to develop an outline of their CAPSTONE project and submit it to the clinic leadership for review and acceptance. If the clinic leadership say, yes, this is something we might actually be able to do, then it is sent on to our CAPSTONE project committee. But we want site leadership to approve it. We don't want, a staff member to choose a project that could never realistically be implemented. So once it has supervisor approval, comes to the CAPSTONE committee, and then we approve it, And then we send it back and they start. They can do a paper, they can do a short film, or they can do a multimedia presentation, but they do have to present to us in person, and they'll have to do an oral presentation. We do not let staff members combine on this. We know a lot of people have reservations about speaking publicly. It's a fear that a lot of people have, but this gives them the opportunity to practice that skill. It also gives the opportunity for them to engage more with our executive leadership, because our CAPSTONE project committee is made up of executive leadership on medical, dental operations. So hopefully it helps to connect them to us and see that we're just people, that we're all here to help each other. So some parameters of what we envisioned: the oral presentation should be at least 10 minutes, not more than 20. It would be nice if they used some type of visual presentation, such as PowerPoint. We will provide them with a list of suggested ideas or examples of other CAPSTONE projects. It could be a detailed or research process to improve or implement. It can be a patient workflow or a Salud workflow. And once staff are enrolled in the CAPSTONE project, once they get approval of their project, they have 1 year to complete and present that project to us. So this is a lot of small words in this slide, but this is our scoring rubric. So when the staff member presents to the committee their project, the background, their findings, conclusions, recommendations, this is how we will score the project to see if they pass. And again, you'll get these slides later, so I don't expect you all to read it, but we try to structure it as much as possible so that it is as objective as possible. We're trying to remove as much subjective as we can. When staff complete the required section of the ladders, which will be the end of level 1, which must be done at the end of 2 years, they do receive a raise with us. And then when they complete the entire ladder, they get a much larger raise. Now, I did put a little asterisk here. This is from our CEO and CFO, that all raises are based on budget considerations. But at this point, we have always honored that they get the raise when they complete these sections. So there is a financial incentive. It's not just improvement for the staff themselves, feeling better about their work, more confident. It's not just that they now have a path to advance within the organization. There's also incentive component as well. So we'll just wrap up here with a few slides on if you decide to build your own training program, just some of the recommendations from us as we've gone through this. We do recommend, again, keeping the courses short, 30 to 40 minutes if possible. That way it's easier to pull somebody out to say, okay, you have 30 minutes to work on this versus an hour and a half. It might be harder to pull somebody out of the clinic, a medical assistant off the floor, to take this course if it's a really long course. And then we do recommend having those quiz questions at the end, just to make sure that they retain what was in the course. And we have found it helpful to have these questions, a larger question bank than what is asked. So if they have to retake the quiz, it's not the same questions, because they have to retain this knowledge. This isn't a race. They have to actually learn it. We recommend that you create your curriculum with clear learning outcomes that can be tested and measured. It's helpful to use a course development program such as Articulate 360 or Adobe Captivate. And then it's helpful to create a roadmap for the courses and learning outcomes, and then work from there to develop the courses. Again, for dental, how did I know what to put in my course? I had the AMT outline of what it took to pass their certification exam. I asked my staff what they wanted to know, and then I added in things I wanted my staff to be strong in at my clinic. And then we worked backwards. Okay, here's where they have to be at the end of the ladder. How do we divide this into 3 different levels? What should come first? What comes in the middle? What comes at the end? And then, you have to articulate why this is important to the staff to participate, that this is to benefit them. This is a big investment from the exec team, financial, time-wise. We wanted our staff to know that we did this for them, to help them. We had a lot of support from our CEO, and I think that messaging is really important. And then it does take time to put these together. We estimated that per course, it can take 40 hours up to 60, depending on how long the course is, whether you're making videos or not. But it does take more time than we originally anticipated. We started this process in 2014, and it took us about up to the pandemic to finish through level 3. And then the pandemic stalled our completion of the CAPSTONE project, but now we're ready to complete that. All right, that was a overall summary of our career ladders. So I'd like to open it up to any questions at this time. And I think I can open up the questions here. And you're welcome to type them in, or you're welcome to just ask as well if you want to take yourself off of mute.
Yeah, it looks like you have one that's asking, what are the ROI, the return on investment metrics you use to evaluate this program? So do you have any way of seeing like, this is what we put in and this is what we get out kind of financially for budgets?
Yeah, great question. And I've been asked before, did we see like an increase in our retention rate, for example, as we train them to be more knowledgeable in their roles, did we see less turnover? Unfortunately, when we completed this was close to the pandemic. So I think that kind of hampered some of the metrics. We didn't really build a statistical model to evaluate the impact that this had on staffing. A lot of it is anecdotal. Message when I talk to my assistants, I'll just use dental assistants again because that's where I work. They'll say how much they appreciate now that they are certified, that we got them to the point that they're a certified dental assistant. We pay for them to do it. We give them the CE, that we invested in them to do it. And I think a lot of people were really fearful in the beginning. They viewed this as, well, you're going to make me pass this or you're going to kick me out. Like I can't be a dental assistant anymore. You're forcing me to do this. And it's a lot of work, which it was. But now many of them appreciate it. But as far as like data, statistical measures on the effectiveness of the ladders, I don't have those. I know HR was trying to track the retention, but again, I think the pandemic affected that. What I will say is that now that we feel we have a solid training program for new staff, it does broaden who we allow to apply for our positions. Again, for a dental assistant, you don't have to have any experience. You don't have to have any training at all. If you are the right fit, I now have a training program that will get you to be a certified dental assistant. So, anecdotally, recruiting has been easier now as well, but I don't have numbers to provide you. Other questions?
I don't see any currently. While we're waiting, I did have one about, you kind of had an estimate a couple slides back about the number of hours kind of each course took, that it was somewhere in 40 to 60. Was that kind of combined person hours, or was that you'd have several people each working like 40 hours to create a course?
Oh, no, that would be combined. So if you had multiple people working on it, it would be finding the content, writing it, finding the pictures, making the videos, making the quiz questions, and then editing it. We had a person here who was like a designer, right? And they would try to make it look interesting to staff. So from start to finish, about 40 to 60, but that's not combined people. That'd be total hours of work.
Yeah.
And we got better at it as we went on, obviously.
Yeah, I mean, it sounds like you made good use of a lot of in-house kind of resources, even if they weren't official resources, just people who are interested in helping out and kind of learning the skills as they went and built the courses.
Right. And some people were really excited to participate, which was great.
Yeah. Excellent. Well, that's terrific. And I don't see any other questions in the chat. So, we're happy to wrap up a little bit early, but before people leave, I think Mariah is going to put an evaluation up on the screen. If everyone could fill out that evaluation. Dr. Kerns, you don't have to. But yeah, if you could fill that out, that would really help us. And I really appreciate everyone attending today, and Dr. Kerns, I really appreciate you joining and sharing all this. You've built like a full university level program.
Well, yeah, it gets three
really
people
cool.
to the level that they can become certified and pass the certification exams. So
Yeah, no, that's really incredible. And it seems like, did you kind of start with, it seemed like you kind of built each level one level at a time. And so was that kind of on board, did you wait to kind of implement the structure until you had the first 3 levels all built, or we've got level 1 done, let's start people on it?
Yeah, we rolled it out as we went because it's time consuming. You know, if we waited till we had it all done, it would have delayed it for years.
Yeah.
So we had an idea first what we wanted to go in each level, but then we started building orientation first. And then we required all of our current staff to be through that within 90 days. It's just like the CAPSTONE project. We're not done with it yet. We would have been if the pandemic had not hit, but it's been rolled out now for years, even though the last level isn't complete yet.
Yeah. Huge takeaway. When we had a question pop into the chat, would Salud be willing to sell any of these ladders and related training to other FQHCs?
You know, that is a question for my CEO, but I tell you what, I have my, let me put my contact information here. If you send me an email, I tell you what, let me ask my CEO about that. So I don't know the answer to that question. Again, we were really careful with copyright. Again, with our lawyer involved, we made sure we didn't infringe anywhere.
Yeah, it sounds like you were smart in planning ahead to be able to share material and to use the materials without any issues. That's definitely a big deal. Excellent. And all right, and once again, everyone attending and the people that weren't able to make it but watch the recording will have the slides and everything. So yeah, hopefully people will reach out to you with questions. And yeah, I really appreciate your time today. This was fantastic.
Yeah. This is again, I think workforce is a problem everywhere right now, especially, and this is, you know, just one option about how to tackle it. It's worked for us. So yeah, happy to share the information.
Terrific, thank you. Well, if you don't mind, real quick, I will share my screen. Okay. At the very end here, I need to do a quick plug for ACU's conference coming up in August. And so anyone that is interested in joining us in person in DC, the first few days of August, we are having our conference. And then obviously we have lots of resources available to help you out as well. And we have some LMS courses of our own, not quite the degree of, no one's going to get a medical or dental assistant certification out of ours, but on the HR side, some very helpful things as far as staff development and recruitment and retention. And then obviously you can reach out to us as well. And yeah, Dr. Kerns had his information up before, so hopefully anyone that doesn't already invest really heavily in staff development is starting those gears turning and everything. So yeah, thank you one last time, Dr. Kerns. This was fantastic.
Thank you. Appreciate the time.
All right. Take care, everyone.